Health insurance. Most of you are familiar with the popular saying, health is wealth. A nation with an unhealthy populace is doomed to fall. As individuals, it is important for you to prioritize your health and that your family and loved ones are also healthy. However, in a society where the majority live out of the pocket and from hand to mouth, getting adequate health care can be a very big challenge for some. Now, some people opt to herbal medications such as agbo and other concoction because it is affordable for them, but there is a new way for you. Today, we are going to be talking about a scheme that is designed to help the average person to get quality and adequate healthcare, which is called health insurance. So stay tuned. Insurance is simply a means to protect one or is a means to protect you from a financial loss and other damages. Health insurance, on the other hand, is a type of insurance that covers a part or all of your cost of medical expenses. It helps to protect you from financial loss in case of unexpected health issues, emergencies, and accidents. Now, it's important for you to note that as of today, there is not any form of universal health coverage in Nigeria. However, the government, in the person of President Muhammadu Buhari, signed into law the new National Health Insurance Act 2022 on May 19, 2022. Now, this served as a replacement for the National Health Insurance Scheme of 1999, which unfortunately failed to enroll more than 10% of the population. Now, the new NHIA aims to provide subsidy for health insurance coverage for vulnerable persons and payments for health insurance premiums for indigents. Now, the goal was to ensure mandatory enrollment of the entire population of the Federal Republic of Nigeria with the promise of improving access to quality and affordable healthcare for all Nigerians. In fact, funds management was transferred from the Health Maintenance Organization (HMO), which funded NHIS, to the state health insurance schemes, excluding HMO from the Governing Council. Now, 83 million poor Nigerians were expected to benefit from the bill. Now, this brought about hope for many Nigerians who pay out of the pocket for their health needs, and a future of universal health coverage was already in sight. However, a few months down the line, that is 2022, like many other promised law, this is yet to be implemented. Now, the question is, what went wrong? A functional health insurance scheme was dissolved to bet a new one, only for it not to now be implemented. Now, as of today, the current economy has resulted in a ridiculous hike in price of drugs and medical consumables. Quality healthcare has sadly become unaffordable for the majority, and those who can afford it still pay out of the pocket, while millions are left unattended and left with no choice but to go to alternative care that may harm them. Now, the healthcare system of the country is nothing to write home about, and it seems that the government is either turning a blind eye to the issue or just being ignorant of the plight of the masses. Now, research by Good Health Weekly reveals that the situation has deprived many Nigerians access to quality healthcare, hence promoting the use of herbal medications, concoctions, and self-medication, leading to heart-related diseases, kidney failures, and sometimes deaths. Now, these health complications have resulted in skyrocketed hospital bills due to preventable complications. We can see that it all cycles down to quality healthcare, which the informal sector, which constitutes a large portion of Nigerian workforce, can't afford. Now, the informal sector includes petty traders, self-employed people, some transporters, and so on. Now, to make sure that the people in these sectors are covered, most states have established their own health insurance schemes to complement the NHIA and ensure that there's overall progress towards universal health coverage. Lagos, Edo, Oyo, Anambra, Delta State are the few others that have their own statewide health insurance scheme. However, residents are yet to embrace this. Now, this could be as a result of poor sensitization and awareness on the part of the state government or lack of interest and trust from the people. Since its implementation in 2023, about 900,000 individuals have been enrolled in the scheme in Lagos, and 330,000 of them are known as to be vulnerable. Now, the story is the same as that of other states. I think this is not impressive enough, and we have to understand the importance of health. And at the current rate of Naira's free fall, I think it's reasonable enough to grab the opportunity to get a health insurance. Now, you can easily register for a health insurance online depending on your state of origin and your residence, especially via their official website. For example, Edo State Health Insurance Scheme uses edhic.org to be stated in the screen as its official website. Now, the process is simple. You enroll by registering online. You choose a scheme that suits you and make a payment monthly or annually, which depends on what is best for you. Now, the payment is about 12,000 naira annually and 1,000 naira monthly. Now, with this, you can access quality healthcare services in your time of need. Some of the services covered include dental care, several illnesses, hospital admissions, and delivery. Now, this can cover for you, for your spouse, and 4 children. So ensure that you get into an insurance before the end of this month. Now, you can reach out to me if you need any information or recommendation for any insurance that you need to be registered with. Alright, guys, thank you for staying tuned. We have come to the end of today's video. Please ensure to register yourself and your loved ones in any of the health insurance scheme that you're interested in. And be sure to like and share this video. Thank you. See you in my next video. Bye bye.